Hey guys, welcome back to my channel. It's your girl Brooklyn Stace, and today we're going to be on the health and wellness topics. We're going to be taking a closer look at something that I think everyone, whether you're male or female, you should be mindful of and aware of as you're listening to your body and the symptoms that your body does give you from time to time. And so we're going to be looking at how you can test your urine at home. It's easy diagnose, diagnose smarter, diagnose easy, as it says. And these are urinalysis test strips. These are kind of the same things that we use. I'm a healthcare provider that we use in the hospitals, the nursing homes, doctors' offices even use these in the clinic. So you can get these right online. You can get these through Amazon. I'll leave the link in the description box. They're individually wrapped. They're convenient, and you can monitor your own urine. Now, some people monitor their urine for different things, different values. A lot of people that are into the keto diet, they'll utilize this to see if they're in ketosis. But then, there's also things like bilirubin, glucose, the specific gravity, the amount of blood, which should be nothing. But what your pH, if you're spilling protein, urobilirubin, nitrate, leukocytes, and these will give an indication of any type of infection going on as well. So we're going to take a closer look at this, but it's quite easy to use. And as I was stating earlier, the number of tests, there's 10 tests in one. Okay, so let's take a closer look at this. So it does come individually wrapped sticks, so they're individually packaged, which is good. The complete urinalysis test strips. Okay, and it also comes with a guide. So it comes with two things packaged. Let's take a closer look at it. And it just, this is really good because, of course, everything you can sign up and scan and do the app thing, or, you can go online for customer care and customer support if you're having any problems. But it's really, really simple. This is the chart that we use in healthcare to measure the lab results once we do what we call the dipstick, the urine dipstick test. Okay, so let's go ahead and open that. But first, let's go ahead and tell you what else it comes with. So it has a really good breakdown of the interpretation of the results. As you could see, let's see if that's in focus. It talks about the leukocytes, which are the white blood cells. And then it talks about the nitrites, urobilirubin, what that is. It talks about the protein, pH, blood, specific gravity. Hopefully you can see this. I was trying to get into focus. There it is. The ketones, the bilirubin, and of course the glucose. All right. So it has a really good description. Like, for instance, I'll just go ahead and read one of them, leukocytes. So leukocytes, or the white blood cells, are the cells of the immune system that are involved in protecting the body against both infectious diseases and foreign invaders. A few white blood cells are normally present in the urine and generally yield negative results. But when the number of white blood cells, or we say WBCs, in the urine increases significantly, then this screening test will become positive. So presence of leukocytes, which is greater than 10 in the urine, may indicate infections in the urinary tract or kidneys. And then furthermore, with the nitrites, I'll go ahead and read another one because these two play into, go along with one another. When the doctor diagnoses you, he also or she also looks at the nitrites. So the nitrites, normal urine contains chemicals called nitrates. If bacteria enter into the urinary tract, nitrates can turn into different similarly named chemicals called nitrites. Nitrites in the urine may be a sign of a urinary tract infection or UTI. To detect the UTI, presence of leukocyte in the urine is also considered. UTI can be present despite a negative nitrite test. You see, so the doctors are always going to look at that. Doctors are going to look at everything. It's going to look and see about blood as well, because blood in the urine is not a normal finding, but it is not uncommon and not necessarily a cause for alarm. Your healthcare practitioner will investigate further to try to determine the source of the underlying cause. So it may be a sign of kidney damage. It may be a sign of infection. So the doctor is going to look at the leukocytes, the nitrites, and blood. But it may be a sign of kidney or bladder stones, kidney or bladder cancer, or blood disorders. Blood is often, but not always, found in the urine of menstruating females. So, just know that, when you're feeling funny, and you're not feeling right and you're having symptoms, they're going to want to test your urine. So it's always good for you to test your own urine, because in this day and age of telemedicine, if you have the results of the leukocytes, the nitrites, and the blood, that's going to help that healthcare provider that you're talking to, that doctor, all the more better. So what you can do with telemedicine, you can upload photos. So you can even just, take a snapshot of the dipstick here, and you could take a snapshot. The doctor can see whether it's trace, small, moderate, or large. With the leukocytes, he can see with the nitrites if it's negative, if it's positive, and how positive it is. Then he's going to also look at the amount of blood and the level of blood. So if you already have this done and you just snap a snapshot of this and the stick, you could put it along. I'll show you here in a second. Just put it alongside of it, and the doctor can just review it. That's going to help that doctor out a lot, and then he'll be able to give you a better diagnosis, and he'll be able to prescribe the appropriate antibiotic or pain med, or tell you that you need to go in for further studies to your primary care doctor. It just will help that doctor out that much better. So now let's go ahead and open this, and we'll take a look at this strip, and let's see here. Easy open. And it comes with, they always have this little thing that, when I was a kid, I used to think this was a salt packet, but of course, this is just for moisture, so it's like an absorbent, what we call a sorbent. It's a harmless sorbent, or desiccant it's called. And it's just to help whatever's in the package stay dry. Okay, so this is the actual stick here. And I'm going to bring back up this test strip. So it does, this test strip, this guide. And so it really tells you, see, hold the strip vertically. So you want to hold it just like that, and see this is what it looks like. And then it also has different time factors. So what you're going to do is just set your timer on your phone for 30 seconds, 40 seconds, 45, 60, and then a full 2 minutes. And once you set it for a full 2 minutes, the alarms will go off, or you can just set it for 2 minutes and then watch when it turns 30 seconds, and then say, okay, let me put it up against this. And then you can say, okay, which color is it? Now you're going to want it to be negative. So these are the negative values, and then these are all the positive values. So you can just kind of like put it at the end here and take a snapshot of it. Or, once you determine what it is, you just move it along there and kind of measure it, try to measure the color as to which one it's the closest to. and then you just take a snapshot of it, and then you just have it so that when you go to your doctor, let's say you make an appointment, and you will say, well, here on this day, this is what my labs were. And then you could take it the next day. When I say labs, I do mean my urine result was. Or if you're talking to the doctor that is on the telemedicine visit, then you can upload this, and you could just put it here in the middle. You can put it on the actual table. Okay, so I just kind of wanted to show you, how you could, like I was saying, just get some information, better information for the provider that you're going to be able to talk to, whether it's your telemedicine provider, whether you're going to show this to your primary care provider. I mean, your primary care provider would appreciate you and showing him this, because he can see, what your urine dipstick results were at the time you were having the symptoms versus by the time you get to his office, because it could be days before you get to his office, and then things are different. But if you would show it, you can see whether it's the same, whether it's better, or whether it's worse. So in you doing this would be a really good help for both you and your primary care provider or your telemedicine provider, because of course they're not examining you. They're doing everything over the phone, over video chat, and by you uploading these test results, this testing color chart, and the read that you're going to, the reading results that you're going to get, that would be great. So what you would do is you would simply, just take a clean cup, preferably, you're at home. So if you don't, you can order the urinary cups, the same thing that we use in the clinics. You can order that off of Amazon as well. You can even order what we call the hat. If you can't squat, or, for females, it's a little bit more difficult to try to catch it sometimes. Or if you have any mobility issues, then you can catch the urine in there, and you simply just dip the this stick in there, and then you would sit this on a paper towel or a napkin or something. Now this is waterproof, so as you're looking at the results, and you may touch it and tap, you can just wipe it off with a wet cloth, because this itself is waterproof. Okay, and then what you would do is just match it up with the different colors that it is. And like I said, take a snapshot, take a picture with your camera. You can opt to leave it in the center just like this, and you can hold it just like this, like I'm holding it now, and you could just take your phone and snap a picture. Okay, you can do it that way, or if you have it down on a surface, a table, a counter, or wherever your hard surface is, just make sure you put something under it, a cloth or paper towel, a barrier, and then you would snap the picture there. Okay, so you can do it that way, and then you can tell the provider what your results are. Now also on this side, there's even a larger one, so you've got two. So you see, it's up to you, whichever is easier for you to read and easier for your provider to read. But this is another one that you can do, and you can leave it on the end like this. Okay, and you can see that these are the negative values, and then you could just move it along until you get each one of them matched up with whatever value it is. All right, and then you can discuss that with your provider. So I just kind of wanted to show you this, guys, because again, no matter if you're male or female, if you have a urinary system, a urinary tract, which all humans do, then you need to be aware of what's going on in your body. And especially with males, and I'm not picking on anyone, but some males have a tendency to not want to go to the doctor. But then, hey, they want to be macho, the testosterone, and they're like, I'll be all right. I don't want to take anything. I don't want to know anything. And then they wait until things are too late, when things could have been simple, and then you could have just, taken care of it. So, if you're watching this video, share it with a male that whether that's your friend, your family, your loved one, your coworker, it doesn't matter. Just share this video and show this to him, and as well as to females. Females, we have to be aware of what's going on in our body, with infection, with urinary tract infections. And, females, we get urinary tract infections easier than males just because of our anatomy and how our urethra is, because the urethra leads from the vagina, or the vajayjay, I will say, because this is YouTube. I don't want to get flagged. So the vajayjay, and it's shorter than in the males, just simply because of anatomy. So therefore, we're prone to get more infections, just the way our anatomy is. Anyway, it's more internal than external, and then we have a lot of things going on with hormones and a lot of things happening. So, for infection and bacteria and yeast and so on and so forth. So, definitely females, we want to be aware of our body and be more in tune with what's going on other than the symptoms. And this is a way that you can definitely tell what's going on in your body, whether you're male or female. So I suggest that everyone get this. I'll leave the links down below for you to get it, as where to get it on Amazon, and just, take care of yourself. That's all it's about. Just being aware of your health and being aware of what's going on in your body, and, just being a better you. We all are trying to live. We all want to be here. Okay. So we have to do what we have to do to maintain our health so we can be functional. So that's it, guys. So that's it. That's all. I just wanted to show this to you. If you like what you saw, please do give it a thumbs up. Please do follow my channel. I will be having other things in regards to health and wellness and products that I've tried, I use, or that I can, suggest to people, just to help people out. That's my goal. Just want to help people to help themselves. So do give me a thumbs up. Please follow my channel. Do subscribe to it. And it's free to subscribe. There is no cost. Just hit the subscribe button, hit the thumbs up button, and share this video with someone else to help them. Okay, that's it. So as always, thank you for watching, and be well. Bye-bye.